begin, I am doing an evaluation of the cranial bones. Okay, so I'm just moving your head ever so slightly, and I'm feeling for any movement in the bones of the cranium. Now, the cranium moves the bones that make up the cranium. They should have some movement in between them. So before I try to do any correction, I'm just trying to feel what type of movement they have. Okay. So again, just touching the back of the head. If you could just take a deep breath in and out. Okay. Close your eyes. Okay. Now I'm just turning the head ever so slightly. Okay. So, ever so slightly. And ever so slightly. Okay. Now it's not anything that you're going to be able to feel. Okay. I'm just testing to see the movement that your cranium has. Okay. Now there should be some movement which allows the liquid blood to flow around. Okay. And it was once thought that the cranium didn't move at all, but it does ever so slightly, and sometimes the bones can get stuck, and this can lead to a reduced amount of liquid being able to flow into the brain, and this can cause all types of problems like headaches, depression, anxiety, tinnitus, ringing in the ears, insomnia, a long list of issues, okay? So shortly after I've completed the evaluation, I will be correcting the cranium bones. And this should hopefully relieve some symptoms, but you're going to need to come back a few times in order for it to work long term. Just lifting your head up and looking straight at me. Okay. Do you suffer with headaches? Okay. And what about depression or anxiety? Okay, so if you can just look at me, I'm going to place my hands on your temples, okay, and I'm just going to feel ever so slightly. So, just placing my hands on your cheeks and just holding your head there. Okay. And if you just relax, I'm just feeling for these ever so slight movements and trying to feel where the sticking points are, okay? I'm just going to go around the back, okay? I'm going to do some feeling of the back of the head. Okay, one hand is on the top of your head, and I'm just feeling here. Okay. Okay. Now it might not feel like I'm doing anything, but there are ever so slight movements in the head that I should be able to feel. Okay, you're not going to feel anything, but it's important that I make sure I find. So just moving the head ever so slightly. Okay. Okay, so as I said, I've noticed that the bones at the lower back of your head aren't moving as they should, okay? And then just these front bones here, okay? There are some issues there. Do you get headaches? Okay. And pain at the lower back? And you mentioned that you did experience depression or anxiety. Okay. And ringing in the ear or unusual sort of pains in the head at all? Okay. Alright, what I'm going to attempt to do now is to relieve, okay, and try and open these bones up again to allow the fluid to flow through and enter the brain, and this should really help some of those symptoms. Okay, so again, it might not feel like I'm doing much, but just this touching and this movement should make a difference. So again, I'm just focusing on these two bones at the top here. Okay, and this faster movement should wake the bones up ever so slightly. Okay, and I'm just going to try and pull them apart ever so slightly. So don't be alarmed by anything I'm doing, okay? Nothing will hurt. It's just trying to get the bones moving in the vibration that they should be. Could you breathe in for me? Okay, keep going in and out. Okay. Now just doing some different types of movements. Okay. Now focusing on the back of the neck, I'm just going to, just in that lump that you can feel at the back, okay, I'm just going to hold that and just slightly pull upwards. Okay, now I'm going to try and match this with your breathing, okay? So if you could breathe in and out, and I'm going to try and match the flow of the bones with the breathing, okay? So in and out. Great, keep going. As I said, you're going to need to come back a few times for me to do this, but today was just a starter session for you, okay? I'm just going to test to see if what I've done has made any difference, alright? So breathing in and out, and again, and out, okay? And in, and out, and in, and out. Okay. I'll just finish with a temple massage. Okay, and you do come back and we'll continue with that session, okay? As I said, it's going to take a few goes to really make a difference, alright? And to just wake up those bones again and get them in the natural rhythm of the body. When you come in again, we'll get you to lie down on the bed, okay? And I'll be able to feel across the body how the cranium is making a difference, okay? How the positioning and how the bone movement makes a difference throughout the whole body.